Welcome to In Case You Missed It, where healthcare is moving out of the hospital, artificial intelligence is moving into the exam room, and CVS is apparently trying to own everything in between. First story, healthcare demand is expected to change dramatically over the next decade. So, according to a 2026 impact of change forecast from Vizient, they're expecting by 2036 inpatient hospital stays to rise by about 7%. Outpatient care could grow by 20%, post-acute care by 31%, and virtual visits could represent 1 out of every 5 routine medical appointments. That sounds promising. More care at home, online, and in lower cost outpatient facilities should save money, except healthcare has a remarkable ability to move a service somewhere less expensive and continue charging us as though it came with an ocean view and valet parking. Hospitals will argue they need the revenue to offset labor shortages and inadequate government reimbursements. Insurance companies will demand lower prices while simultaneously buying clinics, physician groups, and pharmacies. Republicans will say the free market can fix it, while ignoring much of healthcare is now controlled by an enormous consolidated corporation or four. Democrats will propose another subsidy without requiring the underlying price to become any less ridiculous. So, again, policy could fix it, but politics will probably win the day and things will continue to grow as we lower prices, only in healthcare. Second story, AI is getting genuinely useful. So, Deep Health just received FDA clearance for technology that analyzes breast ultrasounds, identifies suspicious lesions, and prepares a draft report for radiologists. In companies submitted testing, it improved cancer detection sensitivity by 8% and, more importantly, reduced interpretation time by 37%. The radiologist still makes the final decision, as they should. This is the kind of healthcare AI we should be welcoming, helping clinicians work faster, reducing administrative burden, potentially catching something humans might miss, not replacing doctors, rather helping doctors stop spending half of their lives typing. And then there was CVS. CVS earned nearly $3 billion last quarter, roughly triple the prior year. Aetna, one of the companies that they owned, their profitability improved after cutting benefits and leaving unprofitable markets. So they saved some money, profitability is up, but they have abandoned those who need care most in some segments. CVS is also expanding GLP-1 services, offering pharmacy access, medication support, transparent cash pricing, and $29 minute clinic evaluations. So bringing more care directly to you in convenient places. So CVS can help evaluate you, insure you, manage your pharmacy benefits, and fill your prescriptions. That may be convenient, and it definitely is. It also means the restaurant, the waiter, the nutritionist, and the person approving your credit card are all working for the same company. Healthcare is becoming more convenient, more intelligent, but more consolidated. All right. So that consolidation of healthcare is what can drive prices up, because what looks like an expense for one of their companies moves into a profit, the profit side in another company. So two of those things that we just talked about are great progress. We should keep a close eye on the third. Thanks. See you next week.